When a patient presents in office with asthma, they very well might present with shortness of breath. So this may occur in just at a specific time, or when exposed to environmental triggers, or it could be when they're exercising, it could be when they're lying down, difficulty breathing when they're lying down, orthopnea. If a patient describes a situation, often this may manifest in children much sooner than adults, typically just because their airways are a lot smaller than adult patients when they're exposed to those triggers. Because their anatomy is just that much smaller, the inflammation that's occurring in this reaction, it tends to just cause a lot of symptoms in children, but this could definitely happen in adults. When you room these patients, you may see in the vital signs that they have a low pulse oximetry level. They may describe having sudden difficulty breathing air. This is a result of the bronchospasm. So these muscular walls of the airways, when they're exposed to this trigger, when they breathe in these triggers, these airways that are always very small amount inflamed in asthmatic patients, when they get involved in these triggers, they inflame even more to the point where air has a very difficult time moving through the airway, because these muscular bands that hold open our airway, they spasm. These mucus producing cells increase mucus. It makes it very difficult for air to move all the way through. The physician is going to come in, take the information that you've gathered during your interview. They're always going to perform a physical examination, check out the lungs, check out the airway. They're always going to perform a health history, ask the subjective information about the patient's health history. And then ultimately they may order a pulmonary function test, which you may do with a peak flow or spirometry test. And then they may order a trial of a bronchodilator like albuterol to see if it helps. If it does help, it might be asthma.